As you know, WellCare will start requiring authorization of CMS recipients as of 8/1. Since that's coming up, I wanted to talk to you about some issues we have with WellCare claims in general that I expect to become more of a problem once CMS recipients also require authorization. WellCare has always been notorious for denying claims for no authorization, even when authorization is on file. For a long time, it had to do with WellCare and EvaCore's system failing to communicate properly. But some of those kinks were ironed out, and it seems primarily to affect claims with no rhyme or reason. Appeals on denied claims are cumbersome and inconsistent. They take 60 to 90 days to get responses or payments, and about 15% of the time, they require us to escalate issues to WellCare's second level to get reimbursement, increasing the time for you to get paid by another 30 days. With that said, due to the administrative burden on our end and the financial burden on yours, EEP and your practice have a shared interest in reducing these denials as much as possible. We've been taking a close look at each denial that comes in to try to identify even small issues regarding the authorization or the actual claim to see if there's anything we can do from either the claims or authorization end to prevent the denial. We've reached out to WellCare reps to try to get a point of contact to help us troubleshoot the denials in a systemic way to reduce denials. We'll keep working on this and we'll try to keep you updated on what we find out. On your end, I wanted to mention a couple things that may prevent denials for your practice. When possible, make sure the auths you obtain are in the treating provider's name. Although auths for WellCare are supposed to be valid for anyone under your tax ID to treat the patient, in truth, having a different therapist than on the authorization treat the child can lead to an initial denial that will be overturned later. Even though it's eventually overturned, you're looking at a delay of 60 to 90 days for payment. Make sure the auths you obtain for your practice have the correct place of service. Sometimes you may request 11 or 12, and WellCare approves something entirely different, like 22 or 99. Keep an eye out for these mistakes and ask for corrections when they happen. I've also seen them put authorizations under the PCP as the treating provider, and that's really problematic for payment. You want to go over every approved authorization and don't just assume that they're approving exactly what you asked for. On our end, we'll do our best to try to keep denials at a minimum and try to efficiently handle the claims that do deny, despite our best efforts. But please keep in mind that a dip in reimbursement may be possible with the new auth requirements coming soon. Please let us know if you have any questions, and remember you have a right to speak up to your WellCare rep or ACA about all the payment issues that you might be seeing.